administration will not relent in its efforts to ensure that timely and efficient emergency care is a right and not a luxury. We will continue to build facilities that secure the health, safety, and dignity of every Lagosian. These were the words of Governor Babajide Sanwo-Olu to the citizens. He says his administration is setting a new benchmark in fulfilling its promise of infrastructural and social development. And this is the Greater Lagos Vision. Welcome, I'm your host, Love Oyeduku. On this episode, Ilera Eko, Lagos launches biometric card reader deployment. Service delivery, Lagos invests over 1.5 billion naira on workforce development. Plus, Civil Service Commission, a new era bettered as Governor Sanwo-Olu swears in 5 new members. Details of these and many more when we return. Please stay with us. The Lagos State government has unveiled a significant advancement in its healthcare delivery system with the deployment of biometric card readers for the Ilera Eko health insurance scheme. These initiatives aims to enhance the security, accessibility, and efficiency of healthcare services for residents across the state. The scheme, also known as EcoSha, marks a major leap in ensuring secure, seamless, and inclusive access to medical services for all Lagos residents. With the biometric card reader system, healthcare facilities can now instantly verify patients' identities, protect sensitive medical data, and eliminate bottlenecks in care access.
It marks yet another milestone in our collective journey to transform healthcare delivery in Lagos State. This launch is not just about deploying devices, it is about deepening our commitment to building a health system that is accessible, accountable, and inclusive for all residents of Lagos. Let me begin by appreciating the unwavering partnership of the Lagos State Residents Registration Agency, Lashma. This collaboration between Lashma and Lashma is a perfect example of what is possible when agencies align their mandates for the public good. With the integration of the Ilera Eko ICT platform and the Lashma database, we are ushering in a new era of biometric identification for healthcare access. The deployment of these card readers starting today with a pilot phase across 100 facilities will enable healthcare providers to authenticate enrollees using their Lashma ID, thereby automatically populating their biodata and preventing impersonation at the point of care. This innovation serves our purpose. It strengthens the integrity of our health insurance system, and it also ensures that the right individuals receive the right care at the right time without administrative delays.
The Ilera Eko scheme is a key initiative by the Lagos State government to achieve universal health coverage. It provides affordable healthcare options for all residents regardless of their socio-economic status. The new biometric card readers are designed to enhance the security and efficiency of the Ilera Eko scheme. They will help to accurately verify enrollees and track their healthcare usage, ensuring that benefits are properly distributed.
But I'm not going to use a Lashma card. The person is going to have his Lashma ID, which is sent to him or her prior to home. Without Lashma ID, you can supply Lashma ID and you enter the national ID on the screen, it will display your information, and then you can proceed to access care. Front desk officers have logged into his platform. They will collect the card from them and place it on the device, and then verify using the card, smart card reader, and the scoop on it. Then so the categories of enrollee from Ilera Eko are either enrollees that are paying enrollee, they pay for the services that they want to render, or enrollees of public servants of Lagos State are also eligible to access care under the scheme. Then the top set of enrollees are the low-end of the cadres who are not able to pay for their enrollee, but for their premium. But the government of Lagos State is paying for their premium. Like I said, the next stage of this development will be that we are also going to have a biometric card reader. Even if you don't come with your card, you can use your fingerprint to identify yourself, and then you'll be able to be verified and access care. Once you place your card there. So this like this, the picture that comes from the Lashma database straight. So especially that information, there has been an integration at the back end between the Lagos State and the Lashma ICT portal and Lashma database. So we encourage anybody that has not gotten their Lashma card to go and get their Lashma card.
Enrollees in Ilera Eko can access free or subsidized healthcare services, including consultations, text, and medications.
What registration covers for an enrollee, irrespective of the MDAs you are, if you are a public servant, and irrespective of any organization you are, if you are in the public space. So far you are resident in Lagos, then you register for health insurance. So now, in order to reduce the numbers of identity card in which an enrollee will carry, that's why we partner with Lashma, so that the lag ID card also functions in so many other ways. Like I said, you can use it as your ATM card, you can use it to pay all your water bills, you can use it to enter BRT buses. So that's why we partner with Lashma on that ground.
The scheme also covers pregnancy and delivery, including cesarean sections. The Ilera Eko scheme has already shown positive results, with many beneficiaries reporting improved access to healthcare and financial relief. Stories from beneficiaries highlights the scheme's effectiveness in addressing healthcare gaps and providing much-needed support.
So the identity management is being secured by Lashma, and they are using a tier 3 data center on top of the range in terms of the security. So it is security proof.
So no data leakage?
No data leakage of any sort. And then currently now, Lashma has also invest in deduplication. Deduplication means that you cannot register for Lashma more than once. So you cannot have more than one card from Lashma.
We have, the hospital. Each hospital has, under government, the Ministry of Health, a data safety officer, that is stationed with the hospital. We are aware of data safety. We are aware of data security, necessities. And also we are aware of the dangers, if this data gets into wrong hands. And I think government has preempted that by providing us with data safety officers who from time to time go around to ensure that this data, this vital information of these individuals are safe with us on behalf of government.
Well, there are built-in safeguards that we know would be respected. And we have an inbuilt IT system that also ensures that that system in itself, protects. What this does is to enable access. It doesn't in itself have access to the patient's records. The patient's records are domiciled on our own system. So this system is just to ensure that whoever it is that is attempting to access is who he or she claims to be, and does not include the vital statistics or health records of such a person. So we're not concerned about that. The whole thing is to ensure that whoever it is that is attempting to access is the person that should ideally have that access.
The Lagos State government, through the Lagos State Health Management Agency, Lashma, remains committed to strengthening healthcare access and improving the lives of Lagos residents. Lashma has made registration for the Ilera Eko scheme accessible through various channels, including the agency's website, USSD code, kiosk, and divisional offices.
It's a symbiosis relationship between Lagos State Resident Registration Agency and Lagos State Health Management Agency. Lagos State Health Management Agency is in charge of health insurance in Lagos State, while Lashma is in charge of identity management in Lagos State. So now we have a situation where some of our enrollees do not have a valid identity card. So the Identity Management Agency in Lagos, we partner with them so that we get identity from them in terms of people wanted to use healthcare services. One, for us to reduce cost of having to provide ID card for enrollees, knowing fully well that Lashma provides ID card for all residents of Lagos, and health insurance is also for all residents of Lagos.
The launch of the biometric card reader deployment is a significant step towards achieving universal health coverage in Lagos State, ensuring that all residents have access to quality health care.
It was a no-brainer when Lagos State came up with this program for us to help to integrate with it. Sadly, the goal for any government should be to achieve universal health care. That is to make sure that everyone who is a citizen of a particular state should be in a position to access care, conveniently and safely, in that organization or in that state, so that we would partner with Lagos State. This is not in itself unexpected.
This is a laudable initiative. It's a good one, and I think it's an innovation that its time has come. Considering the challenges and the feedback we've been getting from patients concerning their cards, the accessing care, and then the protocol in accessing care, it will cut down a lot of steps. It will cut down a lot of issues. The same card reader can have the patient's, vital information, the details, and the patient can make payments from such, even from their own, so they don't have to come with their ATM cards and all that. So I believe that it's going to be very efficient for the patient, for whose reason we and Lashma are here in the first place. And then it makes our own work efficient for the patient, for both Lashma and we. And I believe that, data collection and the uploading of data and the processing of same is going to be more efficient with this better and more efficient centralized, card reader.
Lashma has also reinforced its zero cash payment policy for enrollment and cautioned residents against making payments into personal accounts of sales agents. Lagos State government has invested more than 1.5 billion naira in training, welfare, and development programs for its employees over the past year. The State Head of Service, Bode Agoro, stated this at the ongoing ministerial press briefing to mark the second year of the second term of Governor Babajide Sanwo-Olu's administration. In its commitment to a more efficient and motivated public service, the Lagos State government has invested over 1.5 billion naira in the training, welfare, and development of its workforce in the past year. From professional development to capacity building, Lagos State is equipping its public servants with the tools they need to serve better, smarter, and more effectively. The 1.5 billion investment covers training programs, spans multiple areas, including skills acquisition programs, capacity building, retreats, industrial training placement, and post-service welfare schemes for retirees. According to the head of service, Bode Aguru, the goal is clear: a more responsive, knowledgeable and empowered workforce dedicated to delivering quality service to Lagosians.
Issuance of letters of permission to travel abroad and authority to stand surety. During this period under review, a total of 115 letters of annual leave and approval to travel were issued to permanent secretaries. Also, 164 approvals were given to heads of agencies and parastatals to travel abroad for personal and official reasons. Also, similarly, a total of 620 approvals were given to officers in other categories to travel to the various countries of their choice during the period for both personal and official reasons. Also, 31 letters were issued to officers in various cadres to stand as sureties in line with extant circular, while 105 letters of introduction were issued to various embassies on behalf of officers seeking to travel abroad. Retreats. From Tuesday the 29th to Thursday the 31st of October 2024, the office organized a retreat for directors in the Admin and Human Resources cadre at the Jubilee Chalet in Ekpe with the theme, Fostering Leadership, Development and Succession Planning in the Admin and HR cadre. One of the main objectives of the retreat was to consolidate on reforms in the service. The office has almost completed plans for the year 2025 edition. Procurement and allocation of official vehicles. During the period under review, Mr. Governor, in his magnanimity, gave approval to procure and allocate official vehicles to newly appointed permanent secretaries and Secretary Generals and substantive directors on grade level 17. The pictures are there for you to see. Plans are already in top gear to obtain Mr. Governor's approval for the procurement and allocation of official vehicles to chairman and members of statutory commissions and boards and newly appointed permanent secretaries, as well as heads of agencies who are yet to be allocated vehicles. Similarly, Mr. Governor's approval is being sought to replace old unserviceable vehicles of MDAs as a way of strengthening their capacities for effective service delivery, while substantive directors on grade level 17 are also going to get approval. Intervention policies implemented during the period. Some of the laudable intervention policies implemented during the period under review include, but are not limited to, the following: re-implementation of the 25% basic salary incentive for core establishment agencies, implementation of work time flexibility, which allows public servants on grade level 1 to 14 to work from home twice a week, while those on grade level 15 to 17 were allowed to work once a week from home, with effective from 28th of February 2024. Implementation of the 40% rebate on statutory fees payable to Lagos State Government by public servants on applications for physical planning permits, allocation of government housing scheme, land allocation in the state government schemes. Payment of Lagos State Internal Revenue Service arrears on consequential adjustment, and payment of consequential adjustments in pensions arising from the implementation of the National Minimum Wage of 2019 for pensioners under the Defined Benefit Scheme in Lagos State Public Service with effect from January 2024. The implementation of the new minimum wage of 85,000 naira, in which the state blazed the trail as a responsive, staff-centric government. The Long Service Merit Award. The 15th edition of the Lagos State Long Service Merit Award was held during the period under review. A total of 361 public servants who had spent not less than 30 years in service were honored for their dedicated service. The Long Service Merit Award is a unique opportunity to place on record the state government's profound appreciation for the contribution of public servants to the growth and development of our dear state.
The HOS also disclosed that the state also hosted several strategic conferences and retreats for civil service officers.
The federal circular regarding the 2024 pension review for pensioners under the defined benefit scheme was implemented for Lagos State pensioners under the same scheme. The review comprised of 28% increase for pensioners who retired on grade level 17 and 20% increase for those who retired on grade level 0 or grade level 1 to 16. Mr. Governor approved the pension review with effect from January 2025, with a total allocation of 186,142,238 naira 62 kobo for civil servants pensioners, 136,727,088 naira 49 kobo for TESCOM pensioners, 245,234,418 naira 79 kobo for local government pensioners.
These initiatives, no doubt, may have not only strengthened capacity but also promoted innovation and professionalism across ministries, departments, and agencies. This will certainly, in no small measures, ensure that the Lagos State Public Service remains one of the most efficient in the country. The Lagos State government has allocated over 8 billion naira towards the development of the tourism, arts, and culture sectors in the past year. This is according to the Commissioner for Tourism, Arts and Culture, Toke Benson Awoyinka, who spoke during the 2025 ministerial press briefing held at the Baguda Cultural Press Center in Alausa, Ikeja.
Over the past year, the ministry has strengthened its symbolic relationship with stakeholders across various segments of the tourism ecosystem. We have continued to develop and refine policies that serve as a framework for tourism activities in Lagos State, while also implementing impactful programs and projects that enhance the experience of both residents and visitors, directly contributing to the actualization of the fifth pillar of the Themes Plus agenda. In line with this objective, the ministry engaged with notable industry leaders, including and not limited to the President of the Federation of Tourism Associations of Nigeria, Mr. Bolaji, and Mrs. Bolaji Mustafa, the President of the Nigeria Association of the Tour Operators of Nigeria. These high-level engagements focus on critical issues such as capacity building for tourism officers and the development of strategic partnerships aimed at expanding the reach and appeal of Lagos State as a premier tourist destination. Furthermore, on the 30th of May 2024, the ministry convened a stakeholders engagement session, specifically targeting players in the hospitality sector. The forum brought together a diverse range of operators, inclusive hotel managers, lounge and restaurant owners, bar and nightclub operators, as well as representatives of beach resorts. Discussions at this session centered on prevailing industry challenges, evolving global trends, the review of policy frameworks, the potential areas for collaboration along the hospitality value chain. A key outcome of the session was a consensus on the urgent need to address the issue of multiple taxation, which had been identified as a major impediment to growth and investment in that sector. The ministry has since taken proactive steps towards initiating policy dialogues with relevant regulatory agencies to streamline taxation and create a more enabling business environment for our stakeholders.
That's all we have for you on this episode of the Greater Lagos Vision on Plus TV Africa. I'm Love Ikuku Oyedoku. Bye-bye now.